Hello, and thank you for tuning in for the next installment of the Implementing Simplify My Meds series. As I mentioned in the last video clip, enrolling patients, most of the activities in a medication synchronization program revolve around a patient's pickup date. About a week to 10 days before the patient's appointment date, you start thinking about getting things ready for the patient's pickup day. A call from the pharmacy is made to the patient to confirm what medications need to be filled. Your technology solution may offer either live or automated calls to help you out here. Check with your software vendor for more information. For live calls, we suggest pharmacies use the Simplify My Meds patient contact form, which provides a suggested script and a list of questions to ask the patients about their medications. As you talk with the patient, be sure to note the medications that need to be filled on the patient refill form or in your technology platform.
Hey, Mrs. Smith, this is Kevin from the neighborhood pharmacy. How are you today? Good, glad to hear. We're getting ready to fill your prescriptions for your next pickup date, and I wanted to go over them with you this week. I see that you're due for a couple following refills: fluoxetine, metformin, Crestor, lisinopril. Does that sound right? Okay, great. I just have a couple questions for you. First, have you been to the doctor in the last month? Okay, good. What about any trips to the hospital or anything like that? Good, that's good to hear. Glad you're doing well. Do you have any new prescriptions or any medication changes in the last month since we last spoke? Okay. Do you need a refill on your Lantus this month? All right, everything going okay with it? Do you have any problems? Yeah, those are all normal, so you let me know if anything else is going on. Okay, great. I think that's everything. We should be able to have these ready for you for next week. Do you have any other questions? All right, great. You have a wonderful day, and we'll see you next week.
If there are any medication changes or any adherence issues identified, make a note of these issues and mark the box for pharmacist follow-up. The pharmacist can either give the patient a call sometime over the next week or talk to them when they come in to pick up their medications. Before you hang up the phone, remind the patient of his or her assigned pickup or delivery date. Making this pre-pickup call is crucial to the success of your adherence program. This call is your opportunity to identify any barriers to adherence that you may not have seen otherwise. It gives you a chance to confirm what medications need to be filled so you aren't filling things only to find out later that the patient does not really need them. It also gives you ample time to take care of any issues. For example, faxing the doctor with a refill request or obtaining a prior authorization from an insurance company. So this call should not be overlooked. Also, this pre-pickup call differentiates Simplify My Meds from any automatic refill program. Once all of their medications have been confirmed to be filled and there are no additional clinical issues, you have a week to get the additional refills, order the medication, or request approval for prior authorizations if needed. When filling the prescriptions, use the highlighted patient refill form to determine what medications need to be filled. If you use a basket system, you may think about adding different color baskets for Simplify My Meds patients so you can work on waiters during busy times and save the Simplify My Meds medications until things slow down. Consider calling the patient the day before their pickup date to remind them that their medications are ready to be picked up the next day. Make the pharmacist aware of the patients due to come in and any clinical issues that need to be addressed when the patient arrives. File all the patient's paperwork back in their file. Go on to the next video to find out what happens on the patient's pickup day.